So today's discussion is going to focus on microbiome disorders, research into other diseases that have a microbiome connection. We're going to hear about how gut dysbiosis may be connected to diseases other than GI disorders. And our panelists will discuss why and how the gut microbiome may be connected to autism and depression, bipolar, and other rare disorders such as auto-brewery syndrome. So to begin with, I would like to start by having each of our panelists introduce themselves and tell us a bit about the work that they do. Barbara, we'll start with you.
Hello, I'm Barbara Cordell, and I am the president of the Auto Brewery Information and Research Association. And it's a nonprofit organization that I started back in 2010 because I had dealt with my husband who had auto brewery syndrome. My background is as a holistic nurse, and I have a PhD in health counseling. But when Joe got auto brewery syndrome, that sent me down a path of specializing in that and starting the nonprofit, writing a book about auto brewery. And so that's what I've been doing for the last 13 years. I thank you for being on the panel, and I'm looking forward to any questions about auto brewery and the microbiome. Thanks.
Great. And Dr. James Adams, we'll move on to you.
Sure. I'm a professor in the Center for Health Through Microbiomes at Arizona State University. My focus is on autism because I have a daughter with autism. About 40% of people with autism have chronic GI problems, constipation, diarrhea, pain that can last for many decades. It's very hard to treat. And we've been investigating microbiota transplant, patented a new method for doing microbiota transplant. And we've done 4 FDA clinical trials and found very good improvement in both gut symptoms and in autism symptoms in children with autism. And we're now planning our next study for autism, and we hope to get this novel treatment approved by the FDA in a few years.
You're on mute.
Saffron, you are muted.
Saffron, you're muted.
Sorry. Okay, moving on to Dr. Valerie Taylor, if you could introduce yourself and the work you're doing.
Absolutely. So hello, everybody. Hello from Calgary, Canada. My name is Dr. Valerie Taylor, and I'm the head of the Department of Psychiatry here at the University of Calgary, and I have a PhD in neuroscience, and my focus is on links between the gut microbiome and the gut-brain axis, as it's known. We're currently involved in 4 clinical trials looking at fecal transplant for different psychiatric disorders. We've also created a startup company called Tailored Biotherapeutics and have filed our first patent on a microbial therapeutic that we have discovered based on our fecal transplant work that we hope to bring to trial in 2024. So very excited to be part of this panel and to talk to you about some of these, I think, exciting new discoveries in the gut-brain axis.
Fantastic. And if you've seen the film, you'll know that Valerie Taylor is in the film, and also in the film is Dr. Mark Davis. Mark, can you give us a little introduction to the work you do?
Yes, hello everyone. I'm a naturopathic doctor and I'm a fellow of the American College of Naturopathic Gastroenterology. I teach the naturopathic gastro coursework at Sonoran University of Health Science. And in my own practice, I've been using FMT clinically since 2011 and focused on patients with inflammatory bowel disease since about 2016. And maybe most interesting when thinking about FMT and other diseases with a microbiome connection, I'm the chief scientific officer for a FMT startup in Panama City, Panama, that's Biome Bridge, and also for a vaginal microbiota transplantation clinical startup in Portland, Oregon, which is called Anthera VMT.
Great, thank you so much. Okay, so we're going to jump into some questions. Barbara, I'm going to start with you. How common is auto brewery syndrome, and how do people find out that they have it?
So far, we think that auto brewery is very rare. I'm only in touch with about 800 people worldwide who think they might have it, and only 300 of those have been diagnosed. Now, having said that, we really think that that it's an underdiagnosed syndrome, that there are a lot of other people maybe walking around with this that don't even know they have it. So it's a struggle to try to get the information out there and educate providers, especially. A lot of providers turn patients away because they say, first of all, I've never heard of this. Second of all, I don't think it's possible. So it's very frustrating. But the way someone finds out that they have it, sadly, is often through a DUI when they really haven't been drinking. Other people find out because, like, my husband was having all these episodes, and I kept thinking he was having a stroke or TIAs, or I didn't know what was going on, hypoglycemia. We sought out specialists. He went to a neurologist, he went to an endocrinologist. We over and over and over, we sought doctors out to try to tell us. And this went on for 6 years until one day I was very frustrated. He was having a bad episode, and I took him to the hospital, and his blood alcohol level was over 300, which is a 0.3. For those of you who like the breathalyzer readings, it's not 0.03, it's 0.3. So it was stunning to see, and the doctors didn't know about it. So it's hard to find out, first of all, that you actually have it. We do have protocols now. Our nonprofit has worked with many specialists throughout the world trying to develop diagnostic protocols, clinical protocols for treatment, and we're also trying to do some research.
That's great. Yeah, I mean, it's such an unknown illness. We've done panels with Barbara before, and we think it's so important to raise awareness for autobrewery syndrome, because I think a lot of people, when they first hear about it, maybe even laugh and think, that's so bizarre. I've never heard of anything like that. But the people who are suffering from it are really, truly suffering, and the caregivers of people suffering. Yeah, what follow-up question on that? What is the reaction of people when you first tell them what autobrewery syndrome is?
They're pretty stunned. Everybody from doctors to lawyers to judges. I've testified in courts of law across the country. Patients especially. Now, the patients and the caregivers usually say, oh, that makes perfect sense. It puts all the pieces of the puzzle together. Now we can see in retrospect that was really what was going on. Most of the healthcare providers and legal providers are still unaware. But that's the whole purpose of our organization, is to get the information out, to advocate for patients, and then to conduct clinical trials.
Fantastic. That's all very important work. James, I'm going to move on to you. So most people, I think, know what autism is, but just so that we're all on the same page, could you briefly give us a definition of autism and tell us about how common it is?
Yeah, actually, I think no one really understands what autism is. That autism is a label that we use for children who have certain symptoms of impaired communication, impaired social interaction, and repetitive and restrictive behaviors. But in the same way that 100 years ago, you might say someone has a fever but have no idea what the cause is. There were many possible causes of it. There are probably many possible causes of autism. And our evidence and increasing evidence is suggesting that gut microbiome is a big factor. That we know that infections during pregnancy, like rubella, greatly increase the risk of autism. And so it's not surprising that gut infections during pregnancy could greatly increase the risk of autism. We did a study with Caltech where we sent gut bacteria from kids with autism. They put them into mice. When those mice had offspring, if the gut bacteria were from our typical kids, the mice developed normally. If the gut bacteria were from our kids with autism, they developed autistic symptoms. So it's pretty clear evidence that the gut bacteria in kids with autism can cause autistic symptoms in an animal model, and pretty likely it's contributing to it in autism.
Thank you for that. Valerie, as you mentioned, you're doing some work around fecal transplant as a possible treatment for bipolar depression. What kind of findings are you seeing to date?
Well, we're still in the process of doing our final analysis of our work, but certainly it appears to be very promising. And because we're filing patents, we can't really talk about it publicly yet. But I think that it's encouraging enough that we have started fecal transplant for depression, obsessive compulsive disorder, and hoping to start ADHD coming up.
Wow. And when we hear mental illness, is it a disease or a set of symptoms? And do we know anything about the cause or prevalence?
Mental illness, just like physical illness, is a set of symptoms that leads to a diagnosis of an illness. And so in the case of, and all mental illnesses have a different prevalence rate. Schizophrenia is about 1% of the population. Bipolar disorder is probably 6% of the population. Depression, we're starting to get at some point kind of 20-25%, even higher, maybe impacted. If we think about anxiety disorders, upwards of 40% of individuals may be impacted by anxiety disorders at some point in their lives. And so, really, it is impossible to kind of live your life and not be impacted by a mental illness, either in yourself or in someone that you care about. These are the most prevalent illnesses. And we also know that kind of really there hasn't been a lot of movement in terms of treatments and from a medication perspective in a long time. And we're still using the same types of drugs that target the same sets of brain pathways, with the goal being to change neurotransmitters in the brain. And they don't work for a lot of individuals. And, to your point about symptoms, depression, in order to get the diagnosis of depression, there is a set of criteria. You have to have 5 of these 9 criteria for at least 2 weeks. There's 540 ways in which you could have different combinations of symptoms that would give you the diagnosis of depression. And all of them are treated with the same medication. And so if you have depression and you can't eat anything and you've lost 30 pounds and you can't sleep at all, you have depression. If you have depression and you sleep 15 hours a day and you're exhausted and you've gained 30 pounds because all you want to do is eat, that too is called depression, and they're treated with the same medication. And, our work really is focused on saying that from a gut microbiome perspective, we'd be very surprised if your gut microbiome is the same in those 2 presentations. And this whole concept of really a precision medicine approach, and it may be that we want to target very specific different presentations, and this one size fits all program is probably why many people don't respond to current medications or have really bad side effects.
Very interesting. Mark, I know your specialty is IBD, and you work through a variety of approaches, fecal transplant being one of them. Do you have people approaching you for illnesses other than IBD, and perhaps for the illnesses or disorders that we're discussing on this panel today?
Well, sure. Yeah, it's been 10 or 11 years that I've been working with fecal transplant as a clinician. And so in that time, I've had people with just about every condition approach me. And some of them I've had to say, I think there's almost no chance fecal transplant will help you. And others I'm eager to help. Fascinatingly, I first did FMT with some autistic children over a decade ago. But with my methodology, they did not get any benefit. So I spent years and years and years telling people, I don't think FMT can help kids with autism, until Dr. Adams and his group started publishing. And I had to change my tune and say, I just wasn't doing it right. And I wasn't persistent enough, among other things, with the duration of therapy. And so there's other things that I've worked with where I haven't seen benefit. And I'm so curious to see if in the future, it will turn out that there is benefit there after all, including some neurodegenerative diseases. Like I've been involved with working with a few people with amyotrophic lateral sclerosis, or Lou Gehrig's. None of them have gotten any benefit. Whereas people with MS and Parkinson's and other neurodegenerative conditions can. But am I just doing it wrong? Can people with ASD benefit with more intensive treatment? I'm so looking forward to the next decade as we continue to research the conditions that FMT can benefit from.
That's so interesting. And can I ask what you learned from James's work that you realized you were doing it wrong, or what was the thing that you were doing differently?
Well, so I was using the same protocol I use for IBD, which is almost entirely enemas and 10 days. And if you don't see benefit, except in the severest cases, we stop there and say, oh, microbiome isn't the way into ending your suffering. Let's try a different approach. With patients with severe IBD, I'll do up to 30 days before starting to see benefit sometimes. But at the time, I was doing 10 for everybody. I was relatively new in practice. And so Dr. Adams and his group used a much longer duration, and they were doing upper GI administration of FMT. And so to this day, I continue to be inspired by his work and tell patients, I'm not sure which of the elements I was lacking in, but absolutely I was lacking when I tried it a decade or so ago.
Interesting. Yeah, it is interesting the way you're doing it, Mark. I mean, you're obviously treating a lot of people and seeing certain degrees of success, but I love that you're helping people, patients who really need this treatment. I have a question for James Adams. Are you getting what kind of feedback do you get on the types of trials that you are running with autistic children? Are people generally on
Yeah,
board
so
with this?
we've had huge interest in the autism community in our treatments. That our first phase 1 study, we found 80% reduction of GI problems and initially 23% reduction in autism symptoms, which for what's viewed as a lifelong incurable disorder, it's pretty huge. But then a year later, 3 different parents came up to me and said, Professor Adams, my son's doing better than ever. So we did a 2-year follow-up, 2 years after treatment had stopped. And we found that most of the GI benefits were continuing. But to our surprise, the parents said, my child was just better able to learn, better able to learn language and social interaction and behavior. And so our expert autism evaluator said now there's about a 47% reduction in autism symptoms. Now that was open label, there's some placebo effect, but our more recent placebo-controlled trials show, yes, there's much more improvement, statistically significant improvement in GI symptoms and in autism symptoms. As Mark was saying, one of the big differences with C. diff infections, C. diff is very easy to treat. 1 to 2 doses, 90% cure rate, and typically 2 to 3 days. And you almost never get it again. Autism is much harder to treat. Thanks to our colleague at Australia, who's treated over 20,000 people with FMT. He found that kids with autism were among the hardest to treat, but he treated them every day for 3 months and slowly, gradually saw improvements in autism symptoms, and then also, to his surprise, saw improvement in autism symptoms. So I think I said GI symptoms first and then autism symptoms. So as Mark said, what we do differently is we know that vancomycin, a powerful antibiotic, is good at killing a number of the harmful bacteria in kids with autism. And so we use a pre-treatment of that for 2 weeks first. And then we do a bowel cleanse, just like you'd have for a colonoscopy, to remove as much remaining bacteria as possible. Then we do high dose and then maintenance dose microbiome. And that seems to be important. But so far, we've seen it to be very safe, actually safer than placebo in some cases. And so we think it's worthwhile investigating even higher dosages. So I think where C. diff is unusually easy to treat, I think many other conditions, the GI conditions that Mark was talking about, the psychiatric disorders Dr. Taylor was talking about, I think if we just go to higher, more intensive dosages, I think we'll see more benefit.
Interesting. And question for both James and Valerie. When you're talking about clinical studies, is there any difficulty recruiting people? Where do your patients come from? And do you face any kind of pushback from doctors?
Well, I can
I'll
start.
take,
Okay, you go ahead,
go ahead.
James.
Sorry. So we have a problem with recruiting that we have far too many people wanting to be in our study. So with our child study, we had 1,200 applications in the first 10 days. So our phone wouldn't stop ringing, the emails wouldn't stop coming. We have over 5,000 people waiting to be in our next study. So The autism community really wants this, and we've been blessed that we were only able to do our last study because 1,000 families raised over $1 million and donated it, so we could do our study. And so that's why we've been able to make such good progress.
And we've had very similar experiences when we started our very first clinical trial, which was for depression in bipolar disorder. Clinicians, and our first fecal transplant study was via colonoscopy. We now have moved on to oral fecal transplant. So we have pills, but our first one was colonoscopy. And so clinicians, the people's physicians, dietitians, naturopaths were all saying there's no way somebody with depression who feels rotten is going to volunteer to have a colonoscopy that they don't need. And if people have had colonoscopies, they're not things that people do for fun. They're not necessarily the most relaxing, pleasant experiences. But for individuals who were participating in our studies, they absolutely were reaching out to sign up because it made sense to them. They had always felt that there was a link between their GI symptoms and their mood symptoms. And they had spent years talking to people and trying to get them to validate that. But they were all told that, it was all in their head. And we would say it is all in your head, and it's also all in your GI system. And we absolutely believe that those two things are linked, and we are going to look at trying something different. And so the uptake has never been from the patients because this makes sense to many of them.
Yeah, I mean, as an IBD patient who has experimented with fecal transplant, I relate to that entirely. Because I did over 200 fecal transplants, and I was willing to do over 200 fecal transplants to get that benefit. My doctor still can't really understand that. So this is why we sometimes have this disconnect between doctors and patients. They don't realize how desperate these patients are, how desperate the parents of the patients are. Barbara, I'm going to turn it back over to you. What is the current state of research on ABS? Is it well studied? What kind of studies are they doing? Is there any fecal transplant studies going on?
Oh, yeah, there's a handful. There aren't any studies so far to date that have been published other than survey research, anecdotal case studies, which is part of the reason this is not well believed. People look at the literature and say, well, you have a handful of case studies, but there's no real research. So what we're doing, my nonprofit, is really trying to connect researchers with this disease, find funding. And we found a group. We have a group in China that we're working with. We have a group in California that we're working with, and they are currently they're conducting studies, and my role is to put patients in touch with the research and to allow them to be subjects if they choose to be. So I'm taking those folks that I know are diagnosed and asking them to participate in the research. So the research that's going on right now is the DNA analysis of the microbiome, identifying the offending organisms, whether it's yeast or bacteria, and we've identified both so far that are fermenting in the gut. And that's been, we have very exciting results already coming out. I'm probably not allowed to talk about it too much because they're poised to publish all of this. But the one in China has already published, and they documented this not only in the laboratory, but in mouse studies, that they can transplant the microbes from the patient into the mice. And in fact, the mice will choose. I mean, they do get inebriated, they get intoxicated. So there is some definitive proof. Again, people say, well, that was a small study. We can't really rely on that. So we hope to have bigger and bigger studies. But again, it's a rare disease. There's not a lot of money for it. And patient advocates, as Dr. Adams mentioned, the families sometimes raise money. So that's what my organization is trying to do, is raise funds. We are poised to do the next study that we really want to look at is FMT. So the researchers in California have submitted an NIH grant to go forward with FMT. We've had probably six, I believe is the number right now that I'm aware of in our group, that patients who have done either DIY FMT, or they've gone through a physician, a naturopathic doctor, or someone who's doing the FMTs and gotten, they've gotten permission to try the FMT with varying success. But again, that's only 6 people. So that's why we want the clinical trial. And that's where we're really heading with the research.
That's great. And Mark, you mentioned the work you're doing with the vaginal microbiome. Can you explain a bit more about that?
Okay, yeah, absolutely. So, of course, the intestines are the reservoir of the greatest number of microbes that are commensal to the human body. But the second biggest single reservoir is in vaginal fluid. And there are a bunch of different microbial composition types. And the healthiest are dominated by certain species of lactobacillus, especially Lactobacillus crispatus and Lactobacillus iners. And there's been a bunch of fascinating animal studies on vaginal microbiota transplantation. And there's been one human trial, very respectable trial, published in Nature Medicine, excellent journal, in 2019. It was a small group, but it was working with a group of women with intractable, medically untreatable bacterial vaginosis, which, speaking of prevalence, is very common. And out of that group of 5 women, 4 of them got into full remission and remained in remission for almost 2 years until the study ended, and presumably after the study ended. So excellent study showing great results. Not clinically available in the United States right now, but according to our legal group, in the scope of practice of naturopathic doctors in Oregon. So we should be treating our first patients in February doing that, which we are thrilled to be doing.
That's amazing. We do have an audience question that came in, and I'm not sure if who to send this to, but I'll just throw it out there. Is there any research being done for FMT for adults with ADHD?
We are hoping that is the study that we're going to take on next. We have a large biobank that my lab runs as well, and we get samples from individuals with a variety of different illnesses. So it's probably one of the largest biobanks of kind of microbiome and neuroscience data anywhere in the world at this point. And we follow people longitudinally. So we get samples from them, and then every 6 months we collect another sample. And analyzing those samples, we look at different signatures, and certainly some of our work with individuals who have ADHD have really confirmed what other things have been published in the literature, that there appears to be very distinct microbiome profiles associated with ADHD. So that's going to be the next group that we're currently hoping to start a clinical trial to see if we can address those symptoms.
Fantastic. And Mark,
And we've certainly seen,
go ahead.
I was just going to say that many of the children with autism, adults with autism, also have ADHD. And we've seen improvements in those symptoms. We've also seen improvements in anxiety and depression in those individuals. So again, I think it's a clue that very consistent with what Dr. Taylor is saying, that we suspect quite a few of those illnesses do involve the microbiome.
Yeah, very interesting. I was going to ask Mark, do you have any patients who are reaching out to you specifically with ADHD, wondering if it could be treated?
That has not been a big group to reach out in terms of the microbiome. Fascinatingly enough, since your name is Saffron, there have been some clinical trials on the herb saffron for ADHD, which I've used a little bit, and there's a lot of clinical trials for depressive disorders. And I have not that much experience with FMT and psychiatric disorders in general, but I have a fascinating story of a patient of mine who was doing DIY FMT on his own, even before he came to me, using his roommate as a donor who had been screened by a different doctor. And his roommate left to go on a 10-day meditation retreat, came back and started donating again. And my patient remarked that as soon as he did that FMT, he felt himself flooded with blissful sensations. It's like the meditation hit the microbiome in some way. I don't know if that was placebo effect or if there is some microbiology or physiological way that could be real, but that report blew my mind a little bit.
That's so funny. See, Mark, I love all your stories because you've done so many fecal transplants on a variety of people that we get these amazing anecdotes that, might not be able to be recreated each time, but each little anecdote kind of is a hint, right, of what's going on in that microbiome. So James, we know that autism has been on the rise in recent decades. Do we have good evidence for why that is, or what are the top reasons we think at this point based on evidence?
Well, we know that about 5% or so of cases roughly involve a single gene disorder, maybe a little bit more than that, up to 10% if you look at multiple genes. But our genetic pool is not changing very quickly. So most of the change is due to the environment. There are many things that have been looked at. There's clear evidence that pesticide use increases the risk during pregnancy. We know that certain nutritional deficiencies like low iron or low folic acid can be a problem. Surprisingly, also too much folic acid can be a problem as well. There are studies showing that too much folic acid during pregnancy, if it's unmetabolized, increases the risk of food allergies, doubles the risk of food allergies, also increases the risk for autism. So we could go on more about folate, but that's part of the issue. But we suspect that one of the biggest problems is the gut microbiome. We've been doing metabolomics measurements of metabolites from gut bacteria and yeast. We've identified about 10 that are consistently elevated. Just for one of them, P. cresol, we found 22 studies now. And all of those studies, every one shows an increase in about a quarter to a half of people with autism versus controls. So our suspicion, based on our data, because with just those gut bacterial metabolites, we can differentiate autism versus controls with about 90% accuracy. We suspect that most individuals with autism developed a gut infection, either from their mother, because you inherit most of your microbiome from your mother. And so either the mother had a gut infection during pregnancy or during infancy. We found that some of the risk factors were if you're born by C-section, then you don't inherit much of your mother's microbiome, much higher oral antibiotic use during pregnancy. A very important factor we haven't talked about is mother's milk. That children with autism, in our studies, we found nurse a much shorter period of time. And mother's milk has a very special ingredient in it. The fourth biggest ingredient in mother's milk is a special set of oligosaccharide sugars, which puzzled scientists for decades because the infant can't absorb them. And most bacteria can't digest them. But there's a very special class of bacteria called B. infantis, named after the infant, and a few other of its cousins, which are the only bacteria that can digest this special sugar. And they become the dominant bacteria in the gut of infants who are being breastfed, become 80% of their gut bacteria, and then it disappears. But in the US and most of the Western world, the infantis has been almost wiped out. So very few people are still carrying significant amounts. So I suspect that's one of the major contributing factors. So we think that a B. infantis probiotic the day an infant is born would be essential along with mother's milk, although some formulas now include those special sugars as well. I could also just briefly comment on the auto-brewery syndrome because we've discovered that many kids with autism, there are several published studies now showing that depending on the study, 25 to 75% of kids with autism have elevated intestinal yeast. And in all those studies, they found lower levels in the controls. And we found that as well. But we are the only group that also looked at the behavioral symptoms. And we found that the kids with autism who had intestinal yeast infections had worse autism symptoms. It didn't affect the gut bacteria. And a question I'd have for Barbara would be, do people with auto-brewery syndrome have chronic gut problems, constipation, diarrhea, etc.? Because we found the kids with autism with yeast infections don't necessarily have any worse GI symptoms. The symptoms are neurological. So a simple analogy we'll give is of these 10 metabolites, when we look at them in kids with autism versus controls, the controls may have on average about one of those at a high level. Kids with autism have about 5. So kids with autism, it's like walking around with 5 drinks versus a typical child having 1. So they're just much more impaired for much higher levels. And the reason we think that these yeast infections last for so long and probably this is relevant for autobrewery syndrome, is that yeast, one of the many things yeast does is excrete a protease. And this protease attacks secretory IgA, the major defense in the gut against yeast and bacterial infections. So once yeast is established in the gut, then it weakens the immune system, the secretory IgA. And then you're going to have that infection probably for a very long time until you get treatment. And in a survey of 27,000 autism families, the two top rated drugs are not any of the standard psych meds, but actually two antifungals, diflucan and nystatin, are reported by families to be the most effective for reducing autism symptoms. But they only work temporarily. You stop, usually the symptoms come back. These yeast infections are really hard to get rid of. You seem to need both antifungal treatment and altering the diet. So sorry for went on a little long. I just wanted to make that. It's a very complex question you asked. What's increasing the risk of autism? But there are many factors. The bottom line is, I think there's good evidence that gut bacteria and yeast infections, especially in the mother or early infancy, are major contributing factors.
Yeah, thank you for all of that information. I do want to bring it back to Barbara with your question. Do you find that patients with ABS have coinciding gastro symptoms?
Yes and no. It varies from patient to patient. Our research showed that one of the statistically different aspects of the autobrewery group versus the control group was allergies and food sensitivities. So they tend to be a very allergic group, which could be related, certainly. We only asked the questions on a survey, but those were statistically significant, as were the use of antibiotics, so that people in many of our, or most of our patients had been on long-term antibiotics for something like acne or some other problem that they took long-term antibiotics. But back to the question about the GI symptoms, people often have comorbidities. So they might have gastroparesis, they might have IBD, they might have been diagnosed with SIBO or SIFO. And so it just depends. Most of our, almost 100% of our patients, so report gastric problems, so gas, bloating, digestive. It can bounce back and forth between diarrhea and constipation. So when they're constipated, they tend to have more what we call flares. So they're becoming intoxicated. And when they have diarrhea, they tend to have fewer flares. But often they will bounce back and forth and have lots of those other GI symptoms that aren't necessarily, well, they could be yeast related. It's hard to know. But a lot of our patients also have yeast infections. So they will have seborrheic dermatitis. They'll have vaginal yeast infections. They'll have toe fungus. They'll have a yeast on their skin, in their armpits. So lots of those kind of symptoms too that let us know that they have fulminating yeast in their system. And we find the same thing that James was talking about, that the nystatin and the diflucan only works to a point. And some people stay on nystatin for years. And a lot of our patients relapse and have to come back to the drugs. And so we do talk to them in a very holistic way that this is not a medication cure necessarily. You have to change your lifestyle. You have to eat a low-carb diet so that you're not feeding those fermenting organisms. You have to take some probiotics. You have to de-stress. You have to do all these things that people should be doing anyway to get healthier. And, looking at the lifestyle changes, I have people that, if they can't have a beer on Friday, then they start taking mints or chewing gum or, those kind of things, eating sugar. They eat a lot of sugar. We say, well, that's not any better than cutting out the alcohol. So if you have those organisms that are fermenting, you really have to look at the sugar intake and the carbohydrate intake too.
Mm-hmm. Yeah, and when it comes to diet and the microbiome, Valerie, has there been any research about diet affecting mental illness?
There's a lot of research on diet and mental illness, and there's a whole field of nutritional psychiatry that's really led oftentimes by very knowledgeable kind of nutrition scientists or dietitians that really know this field well. And not surprisingly, things like the Mediterranean diet, for example, have been shown to be very helpful for different populations. Uh, Ketogenic diet, which has sometimes been used in the treatment of epilepsy and then sometimes in autism, which really specifically increases ketones in the body, have also been used in some psychiatric disorders. Again, the thought is maybe that impacts your mitochondria. So there's lots of kind of dietary work. I will say that, for the individuals that we see, which are often individuals who are quite unwell from a depressive perspective, that we often say for those individuals, a dietary change is probably not going to get them well and they need something else. However, if they can get well, often those dietary changes can help keep them well or create an environment where the other medications might potentially work. We've had some just interesting anecdotal findings in some of our clinical trials that we're really not going to be able to kind of talk about until we unblind. But certainly, we had one individual who came in on a high dose of a medication, and I commented on the fact that I was surprised they weren't having side effects like anxiety and restlessness because they were on a very high dose. After they received and the medication didn't cause those side effects, it also didn't work. After they had fecal transplant, within a couple weeks, they suddenly started experiencing side effects of the medication. And so we had to lower the dose down into something that was more normal, and the side effects went away, and the person got well from their depressive symptoms. So it may be that fecal transplant is not working directly in some of these individuals because all our studies are in people who have been on psychiatric medications, but those medications don't work for them. And what may be happening for that population is it suddenly kickstarts a medication. Maybe there are certain individuals who are prone to have a microbiome environment that's hostile to certain other treatments. And so fecal transplant suddenly changes your microbiome and you have bacteria that are going to metabolize current drugs. It may be that once you get well, diet is going to do the same thing. Something resets your microbiome and it's more supportive towards medication if you happen to be taking a medication, and then changing up your diet, eating, avoiding processed foods or other things that have been known to cause problems for some of these individuals. That dietary change might allow them to stay well. And so I think there's some really interesting areas of exploration around understanding how these things work and how they might really work in synergy holistically with other types of kind of lifestyle modification as well to really help keep people well.
Very
If I could
interesting.
just add a quick additional comment. I think for preventing many of these GI disorders, one of the biggest problems we have in the US is our terrible diet, especially low fiber. Women consume only about half the recommended amount of fiber. Men are worse and consume only a third of the recommended fiber. And fiber is so important because a certain subset of bacteria in your gut converted into a substance called butyrate. Butyrate is the food for roughly 60 to 70% of the energy that the cells that line the gut need. So most Americans, they are not getting nearly enough fiber, so aren't getting nearly enough butyrate. So the cells that line their intestines are literally starving for butyrate. So it's no surprise we have a wide range of GI problems in the US, and that leads, we believe, to many of these psychiatric problems. So high fiber diets are probably too late to treat many disorders, but I think it's so important to use them to try to prevent disorders.
Great point. And Mark, I'll throw it to you now as a naturopathic doctor. What kind of dietary advice are you dispensing to your patients?
Well, so really that depends on who the patient is and what their diagnosis is. For example, I am 100% in agreement with Dr. Adams, and I saw Barbara and Dr. Taylor nodding along, that fiber is food for a healthy microbiome. So in many patients, I'm encouraging diverse whole plant foods in their diet to encourage a healthy microbiome and good health. However, for many of my patients with active inflammatory bowel disease, I am recommending the opposite. Their immune systems are having a big immune hyperreaction to the bacteria in their gut. So we want to lower total abundance and actually even diversity by eating low fiber foods for a period of time. Naturopathic doctors also look at different ways that the immune system can react or overreact to different types of food proteins using immunoglobulin reactivity testing, which is comes with some false positives and some true positives, and you have to learn to tease it out. But that type of testing can guide what sorts of foods are best for people to eat. Also, some people have microbes like desulfovibrio that reduces dietary sulfate into hydrogen sulfide and can harm the gut. And if we find that in the microbiome, we might recommend low amounts of brassicas like broccoli and low amounts of alliums like onion and garlic, and even low amounts of red meat. So a lot of different varied diet recommendations depending on the person. And I also just want to add, thinking about the gut-brain connection, how exactly is what's happening in the gut affecting the brain? Well, we have a few ideas. And one is that the vagal nerve, cranial nerve 10, literally picks up information about what's going on in the gut and goes straight to the brain and affects what happens in the brain in that way. But also, microbes are releasing substances that go into our blood, which goes to the brain, and some of those can cross the blood-brain barrier and affect what's going on. The most dramatic example of that is in hepatic encephalopathy, where there's damage to the liver, and the liver is especially unable to filter out ammonia and other microbial byproducts. And those go to the brain and can cause hepatic encephalopathy, which causes mood changes, irritability, insomnia, seizures, and other serious neurological disorders. So we absolutely know there is a gut-brain connection, and diet can affect that, and microbiome can affect that as well.
Very interesting. And I'm seeing the other panelists nod. So getting to a lot of really interesting subjects here. I do have a question from an audience member. Further connecting autobrewery to autism, do people with autism have higher than usual sugar cravings?
Oh, yeah, very much so. I mean, children in general often want sweets. But one of the biggest problems with kids with autism is that they tend to just focus on a lot of carbs and on a very limited diet. Kids with autism like the same thing. So there are some kids who literally may eat only chicken nuggets and French fries. So it's multiple problems. You're not getting the fruits and vegetables you need. You're not getting the fiber. You're missing out on a number of important micronutrients, vitamins, and minerals. So those are certainly big issues. But sugar alone, we had one young boy who was having bad aggression every day in his day program. Finally, he broke the nose of one of his daycare counselors. They took away his 2 sodas and his candy bar that he was having every day for lunch, and that really evened out his mood. You don't have those high sugar spikes and falls. So but yes, in general, carb cravings are a problem for many people with autism, and that's one of the contributing factors, I think.
Okay, great. Another audience question. Do you see the appendix as significant in your FMT treatments?
For me, go ahead.
No, go ahead.
So mostly no. Fascinatingly enough, actually removing the appendix, appendectomy, actually decreases your chance of developing ulcerative colitis. I do think the appendix is a valuable organ and it should be preserved and saved when we can save it. But in my experience, it doesn't work to the way I consider if we're going to do FMT or not.
And James?
We think one of the roles of the appendix is to serve as a reservoir of your gut bacteria. But if you already have bad bacteria in your gut, I'm not sure it's helpful to have it there. As I mentioned, C. diff, very easy to change the microbiome. Autism, very, very hard. Other conditions, I'm guessing in many cases, can be very hard, especially if you've had those conditions a long time. But we haven't looked at that in detail.
Okay. Now we have 8 minutes left, so I'm going to throw out one final question and give you guys each some time to answer it. Can everyone share where you think we will be in the next 10 years' time? I mean, we're talking about these illnesses that are on the increase. At a certain point, do we think they're going to level out or start to decrease? And what will the role of fecal transplant or the microbiome be in that? Barbara, do you want to start? Where do you see ABS research going?
Well, I think we're so closely tied in with all these other issues that have been discussed. And so I'm really excited about hearing from the other three panelists and what's going on in those areas, because I think we're really riding the coattails of a lot of other research, especially when you talk about FMT. We haven't even really begun a clinical trial, and yet all these other clinical trials are going on. So I'm very excited that we'll find out more. You know, I've been immersed reading a lot of literature lately about the fatty liver disease. And, you know, we used to call it non-alcoholic fatty liver disease. We're about to change that to metabolic, because if there are microbes that are fermenting alcohol, which we know there are, and a lot of the people who study fatty liver disease agree with that, then I think our research is going to blow open in this whole area, and we're all connected. You know, it's like saying one part of the body doesn't relate to all the others, but it does. We all, I mean, as practitioners, we all know that it's everything relates to everything else. You're talking about the gut-brain connection and on, you know, immunity and on and on. And I think that's how our research is going to be. So I'm very optimistic, and I look forward to hearing about all the other research and reading different things. I already have my reading list just from today's panel. So thank you.
Okay, great. And James, do you think we're going to continue to see an increase in autism, or when can we hope to reach a tipping point where it starts to level off or go down?
I think because there are so many factors involved, it's hard to know. The rate of autism has been increasing steadily, and it's a big concern. I think microbiome is one important factor, but also important nutrition during pregnancy. That's why we created a special prenatal, the first one tailored for each trimester, that we think will provide the nutritional support to reduce the rates. But longer term with microbiome, I think we hope, you know, unlike probiotics, which are limited to just the probiotics that have been grandfathered in, they represent only a very small part of our microbiome, what's called the aerobic bacteria. The great thing about microbiota transplant from healthy donors is then you're getting the other 95% of the bacteria, your anaerobic bacteria. So I hope within a couple of years or more, we'll have microbiota transplant approved for autism, and I hope for many other disorders as well. Microbiota transplant in general is very safe, but not totally. Few people have become very sick. A few people have even died from diseases they've caught. So it's very important to be carefully tested, and you really examine the donors very well. So I think it has great promise, but I want to make it clear the FDA still views this as an experimental treatment for anything except C. diff infections. So it shouldn't be something you do on your own with your neighbor, because I mean, just what's good for one person may not be good for another.
Yes, of course. And of course, designer shit is about my experiment with DIY fecal transplant. But of course, we always issue a disclaimer. Please work with a doctor, perhaps a naturopathic doctor. And we think clinical trials are a really good option for anybody who is, you know, desperate, really wants to try this treatment immediately. See what kind of clinical trials are going on, because there are a lot popping up, and it benefits all of us to participate in the clinical research. So Valerie, I'll turn it over to you. Where do you see your work going in the next 10 years?
I actually hope that in 10 years we've actually moved beyond fecal transplant, because you know, as Dr. Adams mentioned, that you know, it can be really helpful for some people, but it's not without risk. And so I hope we've been able to kind of take that fecal transplant work and move into specific move from designer shit to designer microbial therapeutics, and that we can figure out exactly what someone's bacterial profile tells them about the things that they need or that they have too much of, and create medications specifically tailored, like supercharged probiotics that have consortia of bacteria in them, and that everyone can specifically get that type of treatment to specifically treat the illnesses that they have. And I think, the thing that's moved this field along so much, so rapidly, is our technology has gotten better. So, 20 years ago, we couldn't identify many of these trillions of bacteria that we have in and on us. And now we can, that there's a capacity to really be able to not just tell which type of bacteria, but which substrain of bacteria. And so, we can really be specific, because it may not be just lactobacillus, and maybe lactobacillus XYZ, and that's the one that you need. And so as the technology is allowing us to be more and more specific, I hope we really get into a precision medicine approach to this field, and we can design specifically tailored drugs to help individuals get well. That's my goal for 10 years from now. I really hope that that's what we're able to achieve.
Great answer. I hope that as well. And Mark Davis, anything you'd like to add? How do you see the next 10 years going?
Well, so in terms of what's going to be happening with hyperinflammatory conditions, if you look at the historical curve, not only autism, but inflammatory bowel disease, celiac, multiple sclerosis, most autoimmune and hyperinflammatory conditions have been substantially increasing over the past 50 to 100 years. One of my favorite books, Epidemic of Absence, details some of the reasons that might be. So I think we're going to continue to see more hyperinflammatory conditions. And regarding microbiome medicine, I totally agree. I think we're going to see amazing designer microbial therapeutics coming out of the Taylor lab and the Adams lab and other places, and getting more precise. And I think we're also going to see value in whole microbiome treatments like whole stool FMT and whole microbiome VMT in coming out of other labs, where we're not as precise, but we have more broad, natural, general consortia of microbiota.
Fantastic. Well, thank you all so much. This has been great. Karen in the comments said this discussion has been amazing and each speaker is excellent and she wants to hear more. So you guys have given us all a lot to think about. I want to thank all of you for sharing your time and knowledge with us. And I want to remind everybody else that Designership will be released November 14th. It's next week. And right now it's available for pre-sale. You just go to designershipdocumentary.com to see where you can view it. And if you enjoyed this panel discussion, please join us for others that are scheduled throughout the month of November. They're all free of charge and you can register at designershipdocumentary.com. So thank you guys so much. This was fantastic and we appreciate your time.
Thank you, Saffron.
Thank you.
Bye.